Have you ever seen a doctor do something totally unhinged to a patient and you didn't speak up to protect the patient? Yeah, me too, and it sucks. So this happened a few years ago, and I still lose sleep over it, wishing I had done more to advocate for the patient. And on the topic of advocacy, I believe it is the single most important role of a nurse. Yeah, we start IVs, we give medications, we bring patients comfort in the midst of their suffering, but the most important thing we do is advocate for patients. So I was working in the emergency department. I was new-ish to this hospital, and I only worked part-time, so I didn't know all of the consultants. But there was a patient that came in about mid-50s, which is, in my opinion, way too young to suffer a catastrophic life-ending illness. And the patient had a hemorrhagic stroke, and the neurologist came down and wanted to start an EVD, or an extraventricular drain, or external ventricular drain, to help reduce some of that increasing ICP on the patient. The patient had a significant deficit. If I remember right, the patient's NIH was like a 22, which is a pretty high number. There's bleeding inside the skull, around the edge of the brain, is a subdural hematoma. And so an EVD is when the physician will drill a hole into the skull and then put a catheter down into the ventricles, which is this tiny little swimming pool of CSF, or cerebrospinal fluid, in the middle of the brain. And if the pressure is increasing, we can drain off some of that CSF to allow some room for that bleeding that is pushing in on the brain. We don't want that brain to herniate or squirt out the hole at the bottom of the skull, because that's unrecoverable. So it wasn't even my patient, but we were all kind of aware that this was going on in the emergency department. I got a heads up from the charge nurse that said, hey, don't try to challenge this doctor. He's a little bit of a Wild West, and he'll chew you up and spit you out if you ever try to challenge him on anything. And I was like, ooh, good to know. I'm conflict avoidant. So it wasn't my patient, but I did ask the primary nurse, hey, do you mind if I step in? Do you need another set of hands? I would love to be able to see this inserted. I hadn't ever seen one put in before. I've seen patients who had an EVD. I've watched them be managed in the ICU when I do my clinical time, but in the ER, that's pretty rare that we put in an EVD at the bedside. So when I went in and had a look at the patient, the eyes were open. The patient was not able to answer questions. There were deficits with the motor strength of the patient. And the primary nurse had some analgesics and some paralytics pulled up, and the neurosurgeon said, what I need you to do, talking to me, is hold the patient's jaw steady so that when I drain the hole in the top of the skull, the patient's head isn't flopping around. And I thought, this is going to be pretty brutal, but yes, I can do this. And so he starts to drape the patient and shave the scalp and get ready for the procedure. And I'm thinking, okay, this is normal. The ER physician wanted to see it too, so he was at the back of the room. There was an ICU nurse who came down because the ER nurses were not going to know how to set this up, right? And then the primary nurse for this patient who's holding the medications. And as the physician is getting ready, he comes at the patient with the drill. It's like a hand crank. Like, think about like at Olive Garden when they're cranking cheese on your plate, except it's a drill, right? And I look over at the primary nurse, I look at the patient, I look at the neurosurgeon, and I'm thinking like, when are we going to give this medication? And all the neurosurgeon did was put a little bit of local lidocaine there in the scalp. But this patient's awake, and he's getting ready to drill a hole in the skull. And I look at the primary nurse, and I said, are you going to give those meds? And he goes, and I look at the neurosurgeon, and I finally said, do you want any of these meds on board? He said, no. The ICU nurse said, if we give the patient sedation, it's going to alter the stroke assessment. And I thought, I do have an awareness of that, but I actually don't want her to be aware of this situation. And y'all are going to do it anyways, what I was thinking. But again, I didn't want to speak up because I was warned, don't challenge this neurosurgeon. So I'm thinking, okay, I grab the patient's jaw to steady the head as the surgeon begins to crank, and I can feel the grinding of the bone in the patient's mandible as I'm steadying the head. And it's taking a lot of work for me to steady that patient's head, because as he's cranking, the patient's head is trying to flop around. That's a lot of force to drill a hole in the top of the patient's skull. And I'm thinking, I'm looking at the primary nurse, I'm looking at the trauma surgeon, I'm looking at the patient. The patient can't speak, but I can tell the patient is in there. The patient was trying to scream and kept going. I could tell the patient was suffering, and I felt horrible for this patient. I again look at the primary nurse. I mouthed analgesia. He mouths back to me, I don't know. The ICU nurse is back there setting things up, and I remember thinking, this is the biggest ethical dilemma I have ever faced, and I don't know what to do. So, like I said, it's been a few years ago. I've ruminated on it many times. I even talked to the ER doctor after this situation was done and the patient was moved up to the ICU. I said, hey, that seemed really unethical. Have you ever seen anything like that? Like, did you want to speak up? Because I felt like I couldn't say anything. And he said, yeah, that was pretty messed up and I didn't know what to do about it. So what would you guys have done in this situation? And have you ever faced anything like this? I'll tell you, the lesson I learned is that I'm always going to take the risk of getting my hand slapped if it means that I advocate for a patient. Never again am I going to feel so yucky inside that I don't speak up for the patient. Next time, I don't care if the neurosurgeon yells at me. I'm going to fight and make sure that patient gets analgesia to treat the pain or sedation so that they're not aware of this procedure, and make sure that they're not traumatized by what we're doing to them.